By the way, within women, does orgasm at all correlate with underlying health?
Yes, we do. We see that. We know that orgasm is related to strength of the pelvic floor, vascular blood supply. So there are issues. So there's a lot of sort of bidirectional, if you're healthy enough to be able to have an orgasm, then you can have an orgasm. And if you're having orgasms, you're likely healthier. So there's a lot to that.
Mm-hmm.
And we know that bidirectionality, but I think still looking at the numbers, I'm hoping that you're thinking, oh my gosh, this matters. This is a big deal. We should, we classically think about sexual health as sort of an afterthought. When we think about longevity, we think about cancer screening and prevention and chronic diseases and now sleep and exercise. And once we've sort of addressed all of those, we now have the luxury of addressing sexual health. And I just think we should put it a little higher on the list.
Okay, so let's talk a little bit more about foreplay. When most people hear foreplay, they assume what? Anything that is sexual shy of intercourse? How do we define foreplay?
Great question. There's medical definitions of foreplay and social. So social definitions tend to say anything outside of penetrative intercourse. Medical definitions rely more on the physiologic changes that are happening in your body, increased blood flow, recruitment of swelling of the clitoral nerve, physiologic signals from your brain that sort of prepare you emotionally to participate in this interaction.